Hi, my name is Patricia. I'm a level 3 health and social care teacher. This morning we're going to look at one of the exam units, Unit 2 Working in Health and Social Care, which you girls have already started. So we've got 3 sectors that we look at as part of the exam unit. We've got the social care sector, healthcare sector and the educational sector. If you can look at these job roles on here, we've got doctors, nurses, midwives, healthcare assistants, social workers, occupational therapists. Is there any of these job roles that you don't know anything about?
We don't know a lot about youth workers.
Okay. Occupational therapists, do you know what they do?
No.
Okay. Occupational therapists are, it's a job role where if somebody's had surgery or been in hospital and they come out of hospital, what they'll do is they'll assess them in their own home. So first of all, they have to, if they've had surgery, so somebody like yourself might have gone into hospital, you've had a pot from here to your hip, right to your tip of your toe, okay? You've had a really bad injury, you've had your surgery now, you've come out of hospital, but you can't get upstairs, okay? So occupational therapists will come in and assess your home. Because you can't physically get upstairs, they might supply you with what's called a commode. Have you all heard of what a commode is? It's like a mobile toilet. Okay, it's temporary, okay? But these are some of the job roles that we have to look at in terms of for this exam unit, for Unit 2, okay, which you can either do in your first or your second year in health and social care, all right? So you need to know the knowledge and qualification of each of these job roles. So that's like, for example, a doctor. How long do you think a doctor has to study for when they go to university?
4 years, maybe 5 years.
A little bit more?
8 years.
7 years. That's once they've qualified. Then they have to go, then they're in, the first 4 years they're at medical school, okay, university. Then they're going to hospital, okay. They become a junior doctor. Have you heard of F1 and F2? We've all watched Casualty or Holby City, where they have these different levels of doctors, okay? And then they've gone from a junior doctor, maybe a registrar, then a consultant. So there's different levels. Some of them can study up to 10 years as a consultant. So if you want to go down the doctor's route, health and social care is where you to start, okay? All right, so what about nursing? Anybody want to do nursing? If you want to do nursing? Nursing, adult nursing or child nursing? Adult nursing, okay. What do you know about adult nursing?
Don't you have to do like 2 years? 3 years?
3 years.
Yeah.
So it's a 3-year degree pathway at a university, or you can do a 4-year apprenticeship, okay, where you can do that with the NHS, or you can do it with Locala, which is like your local community medical centres or health centres, okay, so you can do it for 4 years. Still the same qualification, you still get your degree at the end of it, okay? It's very hard to get into child nursing.
Yeah.
Same like midwifery or anything like that. But at the end of the day, don't let that dishearten you because your cousin said it's hard to get into.
Yeah.
Because if you've got the ability and you like working with children, whether you want to go down the child nursing route, it's, you know, if you want to do that, then just, you know, that's fine. But for each of these job roles, for the Unit 2 Working in Health and Social Care, the exam unit, you need to know the knowledge and qualification for each of these job roles. You'll need to know the skills of each of these job roles in terms of what they do and what it requires to do that job for each professional, and you need to know the personal qualities or professional needs for that particular job role. So if I said personal qualities for being a midwife, what would that be, one of the personal qualities? What is that? Personal qualities or attributes? Welcoming. What else?
Good under pressure.
Good and working well under pressure. That's a good one. What else?
Relaxed.
Relaxed. Why relaxed?
I don't know.
Relaxed as being approachable. You know, want to be approachable. Having good listening skills is really important.
Communication.
Communication, yeah, well done. Next. All right, so these are some other job roles that some of our students have gone into over the years that they've studied. They've gone and done a degree or an apprenticeship. So we've got healthcare support assistants, social workers, dentists. As you can see, the list is endless. If you have a look at the list on the board, and the same one that's on here, can you tell me if there's any job roles on there that you don't know about?
Pathology.
Pathologist. So have you heard of a pathologist at all? Not at all? Okay, so this is somebody who works in the path lab. So basically they work with dead people.
Oh.
Okay, so have you all seen Silent Witness on TV? Have you ever watched Silent Witness? Yes, and they work with, so somebody who's passed, depending on what circumstances they've passed in, they will do a degree in pathology where they'll learn how to diagnose what that person's died from, okay, and unpick it from, you know, how they've died, whether they've been murdered, whether they've been extenuating circumstances, depending on what that circumstance is. And they will work closely with police, social workers and so forth, nurses and doctors. Okay, thank you. Okay, so doctors, general practitioners. So we've got a few different types of doctors, like I said earlier. So we've got doctors, general practitioners who work within our own community, at your local health centres, your local doctors' surgeries. Okay, they care for people who are unwell, including they carry out simple medical procedures within that medical centre or that health centre. They also do a lot of preventative care, okay, health education and also home visits. Although you're not getting as many home visits as we were doing in the previous pre-COVID, 2019, because obviously we've had COVID and they're not doing as many home visits as they were before, okay? Okay, so there's different types of doctors, different types of diagnosis that we do in terms of doctors and general practitioners. So they work the same as doctors in the hospital. So they diagnose patients, deliver health education, so smoking cessation, stop smoking. Have you heard of campaigns for stop smoking? What campaigns have there been for stop smoking?
There was that British Health Lung Foundation.
Yeah, British Heart Foundation did one. What else have you heard? What other campaigns have you heard for health education?
I don't know if this is one, but when on cigarette packets they've started putting photos on.
Yes. Yeah, and that is trying to educate people, you know, like they have the lungs and it's all black, and to try and educate people and to stop smoking. Vaccinations, as we know about vaccinations now, a lot of people have been vaccinated because of COVID, but they're not the only vaccinations that they do. They've been doing vaccinations for years and years, things like the MMR, things like that, measles, mumps and rubella. They do referrals, monitor treatments, administer treatments, prescribe medication, and also they offer treatment plans. So whether somebody is suffering from anorexia or obesity, you know, somebody who's drug and alcohol misuse, they offer all different sorts of treatment plans to support an individual's needs, an individual patient. Okay, so midwives. Anybody want to be a midwife? No? Okay. But midwives is something, a lot of our students go into midwifery. Okay, the pathway, the really strong ones are social work, midwifery, primary school teaching. You know, some even train to be physiotherapists and phlebotomists. We've had a phlebotomy over the years. So midwives play a key role in both caring for mother and baby throughout their pregnancy. Do you know the difference between antenatal and postnatal?
Yeah.
What is it, Willow?
Antenatal, I think, is before birth, postnatal is after birth.
Well done, thank you very much. Next slide, please. Okay, so nursing, we've already spoken a little bit about nursing, but can you think of 5 different types of nurses within the NHS? Can you write it down on your post-it note in front of you, please? Just do this individually for now. Okay, well, you've got 5 between you collectively. I'll take that. What have we got, Willow?
Paediatric nurse.
Well done. And who do paediatric nurse, who do they work with? What's paediatrics? Anybody want to help her? Children, they work with children. Another word for child nursing. Okay, what else have we got?
Neonatal.
Neonatal. What do neonatal nurses do? So babies that are born early.
Oh, so they look after like...
Yes, yeah. So they have working what's called SCABU, which is Special Care Baby Unit, for children, for babies who are born really early, really premature. Okay?
I've got adult nursing, and then what are them nurses called? You know, where they are on like the intensive care area. Is that a different type?
No, they do have nurses that work in intensive care, but they'll come under the special care. It depends on whether it's adult nursing. If it's child nursing, it'll be Special Care Baby Unit. Okay, so children who are really, really poorly, or babies who were delivered early. Okay, and then you'll have the adult nurses that work in high dependency unit. That's what it's called, high dependency unit. Yeah. And they're all hooked up to the oxygen and breathing apparatus to help the patient. What else have we got?
those ones that go into elderly homes? Or is that
It's adult nursing.
Oh.
Yeah, just adult nursing. So you'll have adult nursing that work in the hospitals, but you also have adult nurses and child nurses that work in the community. Okay, and they work collectively with other professionals as well. So these are some of the other nursing backgrounds that we've got on here. Mental health nurse, paediatric nurse, district nurses, neonatal nurses, learning disability nurses, practice nurses, health visitors and adult nurses, and school nurses as well. So they have different, so although you'll do a degree in nursing, you can specialise in some of these areas, and there's lots more as well that you can specialise in. Okay, so social workers, they help and support people of all ages, so children, young people and families. They're professionals that work within our community. They work closely with hospitals, doctors, nurses, police, to help children, young people and adults within the community. Social workers specialise in either, they look at working with, if they're working with elderly people, the elderly people, they might look at maybe dementia care, Alzheimer's care, and work with dementia and Alzheimer's care specialists to make sure that their needs are supported. Or for example, we might have social workers coming into college and working with some of our students in college, especially if you're a looked after young person. So when I say looked after, do you know what I mean?
Have additional needs?
Not quite, that's learning disabilities. Try again, but that's good, but I can see you thinking about it. So looked after is somebody who's in care. So fostered or adoption, okay? So social workers would work with our children, our young people, not children, our young people when they're coming to college to make sure that all their needs are being met, okay? Maybe have visits with them once a week, okay? Okay, so the recruitment of staff, the way in which staff are recruited when working with health and social care service users. So for example, all these different job roles that we've looked at earlier, why do we think it's important that when they're recruiting, that they have to be checked in terms of referencing and things? And what other things do we think that they need? What other checks do we think that they will need? What have you had to go out on placement?
Referrals?
References, okay? But you might need what's called a DBS check. Okay, DBS is a data barring service. So if you're going out on placement with us in the college, or even when you go out to be a nurse and you're at university, you will have to have what's called a DBS certificate to make sure that you can go out and work with vulnerable people, even in a placement capacity. Okay? So this is what the placement, it's a legally binding document, it's certified. So you either have a standard one, so as a student, if you were going out on placement and you was on our extended diploma in health and social care, you would have to have a standard certificate for DBS. But as a teacher, like myself, I need a more enhanced one, okay, to make sure that I've not got a criminal record, to make sure that I can work with vulnerable people. Even as a social worker, you would have to have an enhanced one because you're going to be working with very vulnerable people, okay? And these are all the things that could come up in the exam on Unit 2. And these are kind of things that you need to make sure that you know. So you know that you're not only knowing about the job role, okay, the content of the job role, the qualities that you need, the skills, the attributes, how long that person needs to study for to do that job effectively, okay? But also, you need to know what kind of referrals that they need and what kind of references they need to support them. Okay, so legislation also, we look at protection of vulnerable adults. So all those particular job roles that we looked at earlier, doctors, midwives and so forth, they need to make sure that they're adhering to and following certain types of legislation within health and social care. All right, so this is one of the mini case studies around Unit 2. So Dan and Mary have got different needs. Dan has bipolar and Mary has the first stage of dementia. Have you all heard of these particular illnesses? Dementia, what is it? Tell me what it is. Brief synopsis of what it is.
It's where your memory cells start to die in your brain, so yeah, lose your memory.
Well explained, well done. Bipolar?
Bipolar, where you can have ups and downs.
Yeah.
And it's like extremes at each end.
Yeah, good. So if we're looking at Mary's grandmother, Dan he looks after his grandmother, he's his sole carer, but they've both got different needs now, so they have to be assessed differently. How do you think that we would support their needs separately?
Maybe down for counselling.
Perhaps, yeah. Okay, what else? That's good.
And some medication to try and balance it out.
Yes, because like you say, they have ups and downs, don't they? And sometimes they'll be quite predictable, so they can be quite happy and quite jolly. And this is not all, there's a large spectrum of bipolar, and people suffer from bipolar. Some people have got mild symptoms and they can manage without, you know, just a little bit of counselling, without medication, and some people can be quite manic with it, okay? So they can be talking to you, right, you know, really nicely, and then they can just change in seconds. Okay, so if we go to the next slide. Okay, so Dan's mental health needs affect his moods, okay, and his behaviour. So like you said, the ups and the downs. However, he needs to be in supported housing now. He can no longer look after his grandmother, and he can no longer look after himself. So supported housing or sheltered housing, that's what they would offer him. In that organisation, within that sheltered housing, he would get the help that he needs. Okay, so the medication, the counselling and the everyday support. And he'd have support 24/7 to make sure that his diverse needs are being met. So for Mary's needs, Mary's confusion, like you said, what did you say earlier about dementia?
About how your memory cells die and you become more forgetful.
Yes, okay. So a confusion's going to be increased, okay? Becomes more forgetfulness. Have you been reading my slides? And as a result of her Alzheimer's disease, it means that her routine will change. So, for example, Mary, if she didn't have her grandson with her, could go to the shop one day. She might get to the shop, buy whatever she needs to buy, newspaper, bag of sweets. And on her way home, she might forget her way home. She might forget how to get home. She might forget where the bus stop is. She might not remember that she's not even got a purse with her or a house keys or whatever it is. Because the Alzheimer's, it can be a debilitating illness and it'd be quite quick. Obviously, she's at the first stage, but even at the first stage, depending on what type of Alzheimer's it is or dementia umbrella, there's so many different ones. It could be vascular dementia from a stroke. It could be Lewy bodies. Parkinson's disease and Huntington's disease come under the dementia umbrella. I don't know if you knew that, but they come under the dementia umbrella. There's lots of different types of dementia, okay? But we're going to wrap this up for today. Thank you very much for listening to the Unit 2 Working in Health and Social Care. A bit of a snapshot about our unit in terms of what we do in health and social care. This is an exam unit. There's lots of content to it. And hopefully I will see you at Huddersfield New College soon.